In Health Source 10 tonight, a national shortage of medicine is causing local hospitals to work together to keep patients safe. They're sharing information and they're substituting drugs. But they all worry the time may come when there are no substitutes left for patients.
I'll check and see about the other medication we talked about earlier.
Okay.
Okay.
All right, thank you.
All right.
When you arrive at the hospital, you expect the medicine to treat you will be there, but maybe not.
It's something that affects every hospital throughout the United States.
Pharmacists noticed it first. Drugs they ordered were in short supply, especially intravenous drugs and those for chemotherapy.
There are patients that their therapy has been on hold, their chemotherapy or their regimen has had been changed.
Anesthesiologists who put patients to sleep for surgery noticed it too.
You get a new medication that's missing and there's really no rhyme or reason to it except we're told that there's a shortage.
The American Hospital Association says nearly 200 drugs are in short supply, and that drives up costs.
A drug that you would commonly use on a daily basis that usually costs somewhere between 25 cents to $1 is just gone.
All agree the reasons are complex. Manufacturing problems, including quality and availability of imported raw materials. As more generic drugs become available, it's not profitable for companies to keep making older and cheaper drugs. So every hospital in Columbus works in-house as well as with each other to find drugs in short supply.
We've done a great job ensuring patient safety, but to do that, it requires almost hour-by-hour inventory management.
They figure out ways to conserve what they've got.
Provide unit dosages to patients at the bedside that are designed to minimize wastage.
They suggest alternatives to doctors who can make it work, but worry about complications.
We're having to make adjustments in the hospital, and even then we don't have the medications we need, and so sometimes causes additional complications that we weren't accounting for.
Nurses are troubled by shortage of critical care medicines and unwelcome surprises. In one case, a nurse asked for a caffeine drug for a patient with an anesthesia headache, but the pharmacy was out. Instead, it suggested a Mountain Dew. Doctors and nurses tell us they worry the day may come when there is a serious ailment and a medicine might not be there to help.
We don't have another drug like that, and what are we going to do?
Now, all three adult hospital systems here in Central Ohio stress that so far they're doing a good job of treating patients and keeping them safe. At Nationwide Children's Hospital, they tell us that they have been able to get the medicine they need for their younger patients.